Hello everybody, my name is Wyatt Hinshaw. This is that I'm the founder and CEO of Fundamental Health, but as somebody that works very hard to balance my work and life, I like to start by saying that I'm an uncle, first and foremost. As much as I like to share that and set the tone with those that I meet, it's also a nice reminder for me about the priorities in my life. And I'm founder and CEO of Fundamental Health. So, as the video just shared, Fundamental Health is a 501c3 focused on funding for and connection to quality mental health services for the underserved. Before I get more into the business, I'd like to share a little bit about my story and why I created Fundamental Health. So, I'm not a therapist, I'm not a healthcare professional, I'm somebody with shared experience. So I've been a patient in the mental health system for about 14 years now. I was actually a mechanical engineering student up at UC Berkeley. In my last year, in 2010, I really started to struggle with my anxiety and my depression. So it took me a while, but I raised my hand and I said I needed help. And that's kicked off a 14-year-long journey. And along that journey, I've felt just about every pain point in the mental health system. From paying for the majority of my services out of pocket, to being misdiagnosed, pumped full of medications, and working with providers, to be honest, that did more harm than good. Thankfully, right in the middle of the pandemic, I was able to connect with the care that I truly need. The care that really helped me get out of that dark place in my life and get back to living my life. But as I just mentioned, it took a whole lot of money and it took a whole lot of support around me. And unfortunately, most people are not that lucky. So we decided to create Fundamental Health to basically bring equal access to quality mental health care for all. So to set the scene just a little bit, over half the people in the United States who have a mental illness are unable to access treatment. That's a staggering number. And there are many different barriers that stop people from accessing the care that we all deserve. But just to call out the number one, it's cost. Mental health care is expensive, and unfortunately the way that insurance, whether it be Medi-Cal or private insurance, is set up, it's still far too difficult to access the care that we all need. I'll run through the Fundamental Health model very quickly. We have a little moniker here at Fundamental Health called Fund, Connect, Support. Really kind of describes the three prongs of our program. So the way that our program works in a nutshell is if somebody can't afford therapy, they can come to us. We have a grant program through which we can provide financial assistance for their mental health services. And rather than just handing over a check and saying good luck, because even if you have the resources, it's really hard to find the care that's right for you. We have built out a network of high quality mental health providers. So therapists, psychiatrists, group programming. And then once the individuals we serve, who we call participants, are connected to the right care, we stay involved along their journey through our care coordination team. Essentially a team of case managers. Each participant is assigned a case manager to join them along their journey and support them. And I'll get into a few more details here in just a moment. So to dive a little bit deeper into the three prongs of our program, our grant program, again, this is funding set aside to essentially pay for the services that we connect our participants to. The participants receive the care, but they don't receive the bill. The providers in our network send the invoices to us at pre-negotiated rates. We pay the bill. The participants never pay a dime. Speak a little bit more about our provider network. I will start by saying quality is king. We never compromise on the quality of the services that are available through our provider network. And one of the ways that we ensure that is having an industry-leading due diligence process. So looking at licensing, credentials, malpractice issues, the various types of modalities that these providers might provide. And then they have to go through a series of interviews with our care coordination team that I'll speak a little bit more about later, as well as our clinical lead. And these are third-party independent mental health providers. So clinics and private practices. There's parallels drawn earlier between TALTalks and Amazon.com. We like to think of ourselves as a two-sided marketplace as well. We have those who are looking for services, those who provide services, and we're kind of in the middle facilitating funding and connecting. So it's important from a scalability standpoint that these providers in our network are third parties. They're not 1099s, they're not W-2s, so that we can scale our network efficiently and make sure that we have the very best modalities within that network. There's an expectation that each and every provider in our network collaborates with our team, because it's a long journey with many twists and turns for every participant that we work with. So it's very important that both the providers and our care coordinators are working together to best serve these individuals. Here's just a brief overview of some of the types of services and modalities offered through our network. The main point here is that mental health is very specialized nowadays. It's not just, oh, I'm not feeling good, I'm going to go talk to a therapist. There are so many specialty services and modalities nowadays, and it's important that our network reflects that so that we can connect the participants that we serve to the very best fit care. The third prong of our program that I mentioned earlier is our support prong, and this is really through our care coordination team. Again, essentially a team of case managers that get to know each and every participant that we serve, what's going on with their mind, what's going on with their unique circumstances around them, do they have support in their life, do they have transportation. And so the care coordinator, it's kind of a one-to-one relationship, so each participant is assigned a single care coordinator, is there from intake to placing the participant with the best possible provider within our network. They do that in coordination with our clinical lead. And then the care coordinator, again, is there along the participant's journey with them. So answering questions, concerns, administering assessments every 8 weeks so we can start generating data on how people are improving or how they are progressing through our program. And then when we bring on participants to our program, we set out real-world functional goals that we can both, or that the care coordinator and the participants can kind of drive towards during their time in our program. And so with these goals in mind, we always have a target, a purpose for that participant within our program. I have been saying participants as if this is a, well understood moniker. We don't call them patients because fundamental health is not providing direct mental health services our own. That's the job of the providers in our network. We used to call them clients, but actually one of the individuals we serve came to us at our event this past October, said, I'd rather be called a participant because I have a role to play in this program, in this journey. It's not that these services are just going to be rained down on me and I'm one day going to feel better. I have to play an active role, so I'd like to be called a participant. So we've changed all of our marketing material to now say participants instead of clients. So when we came out of the gates, we focused on two populations, youth and LGBTQ+. I think we're all aware that these two populations are really struggling when it comes to their mental health and access to care. We want to be a program, a platform for anybody and everybody in the future, but if you come out of the gates trying to help everybody, you end up helping nobody. So we really tried to focus on two populations right out of the gate, and I'm very happy to say we have now moved into the homeless population. I think, again, we all understand that there is a real issue with homelessness in San Diego, California, United States. Now, I won't say that mental health is a silver bullet, but it is part of the solution. And so very proud to say that we're now working with that population. And in the future, we will be moving into the veteran active duty populations as well as the immigrant populations. So what's kind of the impact that we've had so far? Well, we have about 20 active participants today. So individuals connected to therapy, psychiatry, group programming, actively receiving services every week. I'm also very happy to say that we have had 2 graduates from our program. So as I mentioned earlier, we set these real-world functional goals when a participant comes into our program, and 3 of these individuals have kind of met and exceeded those goals. So we've graduated them back into society so that they can thrive in life. We have an open door policy, so if you struggle again in the future, you can always come back and we'll support you. But I'm very happy to say that these 3 individuals are thriving right now. I had an awesome opportunity to do a podcast about a month ago. It was called, this podcast, A Spotlight on the Community, put on by Mission Fed. And I had been on the podcast once before, but they said, you know what, once you start working with your participants, come on back, bring a participant, let them share their story. So I did this latest podcast with the mother of our very first participant. The participant, young child, so we didn't really feel comfortable putting them on the podcast, but their mother stepped up, shared their story, shared how through her son's time in our program, he was able to kind of get back to school, pay attention, become a junior lifeguard, and really start thriving in life. So there's a QR code here. I won't, spend too much time on this, but if you guys would like to listen to the podcast, you're welcome to scan the QR code. The way that our model works today, and I think this is out of necessity as we proved our model, is that we pay for the services that we connect our participants to out of our own pocket. We have that grant funding set aside. But this is very tough to sustain, and to your point earlier, it's very tough to scale. So we have started an initiative to move into the Medi-Cal system. Now, I'm not going to stand up here and give one of those inflammatory statements like Medi-Cal is broken, but I do think Medi-Cal could do some things differently, and we want to be that change that we would like to see. We're moving into the Medi-Cal system in 2 phases. So phase 1 would be simply adding Medi-Cal providers to our network, because the reality is the majority of our participants today either have Medi-Cal or qualify for Medi-Cal. So by taking a participant with Medi-Cal insurance, connecting them to a provider in our network that accepts Medi-Cal insurance, we can get Medi-Cal to pick up the bill instead of us paying out of pocket. So that will significantly reduce our costs and allow us to start to scale. And then number 2, which I think is really exciting, we're actually going to be generating some revenue, which who would have thought? So Medi-Cal now reimburses for what's called enhanced care management. That's essentially what our care coordinators do each and every day, meeting somebody where they're at, understanding what's going on with them, connecting them to services, and then supporting them along their journey. So we believe that by moving into the Medi-Cal system, we can kind of be the change that we want to see, because there is quality care within the system. There is funding within the system. It's just very tough sometimes to connect those dots. So I'd like to talk a little bit about our partners. Our partners are key to our success. It's new to us serving some of these populations. So our partners help teach us how to best serve these new populations that we go to, and they collaborate with us so that we can provide holistic care to our participants. So one example that I'd like to call out is Solutions for Change. So Solutions for Change is a wonderful nonprofit in North County that helps the homeless population with housing, nutrition, job placement, but they don't have many mental health resources or services to offer to their clients. So they reached out to us and formed a partnership with us, whereby when an individual that they serve is struggling with their mental health, they'll refer that individual to Fundamental Health. We'll handle the mental health care. Solutions for Change continues supporting them with the housing, nutrition, job placement, and together it leads to much better outcomes. If we were to just approach an individual experiencing homelessness on the street, give them the best possible therapy in the world, but they had no roof over their head or warm belly at night, we'd be spinning our wheels. So it's very critical that we have these partners who support us and our participants. And I'm very excited to share that on the Medi-Cal side, we have late-stage partnership conversations going with both Rady Children's Hospital as well as San Diego County, because when Medi-Cal patients come to them, they can stabilize them, but both of those health systems don't have great access to longer-term mental health care. So we're going to become their go-to referral partner when individuals come their way that need longer-term mental health care. Just a brief timeline. I started this thing December 2022, really started building it in 2023 by forming a team, getting some partnerships in line. We had our launch party in December 2023, kind of introducing ourselves to the world, raised more money than we were expecting by threefold. I think that just goes to show that our community recognizes the mental health crisis, and people are looking for ways to make an impact, make a difference, join in the fight. And I think that we are that vehicle by which people could do that. We started working with participants in February this year, so I'm very proud that we're now up to 20 with some success stories. September 2024, our first graduate, as I mentioned, their mother and I were on the podcast together. And then we just had our second annual event where, again, we blew our fundraising goal out of the water. A little landscape for our current operations and initiatives. So we have 3 distinct departments: clinical, who's really focused on our participants and the providers in our network, as well as leading some of our partnership conversations; business development, which is a team that I lead, so fundraising, partnerships, as well as business model development around the Medi-Cal efforts; and then marketing. And I know some people might look at, why do you guys have a marketing department? Well, people are coming to us in crisis. We need to make it extremely clear who we are, what we do, and how we can help. And we also want to have that warm and welcoming feeling so that people feel comfortable, feel confident in kind of sharing their story with us. We've got about $250,000 in the bank after our last event. We're actively engaging donors. $250,000, not nearly enough to what we want to do. And we are actively submitting grant applications. And, you know, the theme of this year is scalability. So we are expanding our team. Right now, we've got a couple W-2s, but we're a really kind of lean, mean team of 1099s, volunteers, and interns. We're trying to build a real organization here, and so we need to shore up our team. As I mentioned earlier, we're working into the Medi-Cal system, which again will help us cut costs, generate revenues, allow us to scale. We have a very exciting partnership with National University around outcome measures. So we're going to be generating real, clear, trustworthy data around the impact and efficacy of our program. I think this will really open up opportunities around partnerships and funding in the future. And then we're rolling out an electronic health record. Today we have many different disparate systems, processes all over the place, so we want to centralize our interactions and processes with both our partners, our participants, as well as the providers in our network. What are we trying to do today, and how could you all get involved and support us? So, aligning with funders. Obviously, introductions to donors, private foundations. We're also looking for more sustainable funding opportunities, so contracts with the federal government, the state, or at the local level. Kind of funding that we can rely on a year-to-year basis without kind of be dependent on the next big donation or the next big grant that we win. And we're developing innovative ways of keeping revenues coming into fundamental health. So I'm actually the owner of a brewery in Del Mar called Viewpoint Brewing Company. And so we just launched the Fundamental Flight Club, which is essentially a monthly beer subscription for the brewery, where part of the proceeds go back to fundamental health. So you can get your favorite beer, discounted food pricings, and you can do a little bit of good each month. So ideas like that are ones that we want to explore. Partners, as I mentioned earlier, partners are key to our success. They help us enter new populations, teach us how to best serve those populations, and allow us to kind of create that holistic support system that we offer to all of our participants. So would love to meet other nonprofits in the area, serving similar populations to ours, but in complementary ways. And then last but not least, as I mentioned earlier, our provider network. It's really our secret sauce. Quality is king. Mental health is so specialized nowadays. As we enter new populations, we need to bring in those specialists that focus on those populations. So If you know any great providers out there, whether they be therapists, psychiatrists, group programming, outpatient programs, we'd love the introduction. Thank you all very much.